Physician and staff training for prior authorizations. My name is Dr. Jamali, and I'm one of the regional medical directors at Regal Medical Group. This presentation was designed to help our physicians and their office staff to efficiently and accurately enter an authorization. It can also be used as a training tool for any new office staff you may hire, so feel free to save it on your desktops for a quick learning library. In 11 short minutes, you will learn how to put in an authorization and also the do's and don'ts of authorizations with pearls of wisdom on how to get faster turnaround times for your authorizations and patients. Now let's get started. Please go onto your Regal link, put in your login and password, and click Submit. The first page will be the main menu. Select Eligibility link. You will be taken to the Search Eligibility page. You have two main options to search for the patient. Enter Member ID and click Search. Or you can skip that and go to the lower box and enter last name and first initial or date of birth and then click Search. If you get too many results, then you can add more details. Otherwise, the less information entered, the better and faster the results. You will now be on the Select Member page. Click the member name and the member and the PCP's information will autofill. The selected member page refreshes and gives you a summary of the chosen member with all the pertinent demographics. Now on the far left side, you will see blue tabs. Click on Submit Authorization Request tab. A list of options will appear under this tab. Click on Outpatient Request link. The referral request page will appear. The name of PCP can now be found in the Referred From box. Now, if the patient is requesting for this authorization and not really the doctor, then make sure you click on the small square in front of Patient Requested section. You can now choose whether authorization is routine or urgent. Remember, never request an urgent auth if it's for something routine, such as vaccines, screening procedures, and such. You will be contacted to change the status of the request, which would further delay your authorization. Now click Other Physician button in front of Referred To box. The Select Provider page will appear. Click on drop-down menu in front of Select Specialty. A list will appear. Next, choose desired specialty by scrolling down and highlighting it. Select Provider page will reappear with a list of contracted providers. Select the particular provider by clicking on their name. You will be taken back to the referral request page with the Referred To provider field. Next, click drop-down arrow in front of the Place of Service section. You will be given options such as office, ASC, or hospital. Now scroll down and highlight Ambulatory Surgery Center. The box in front of Place of Service will now read Ambulatory Surgery Center. You will be taken back to Referral Request page and will need to click on the Other Facility Company button. The Select Provider page will appear with the Search tool. Click on drop-down in front of Specialty box. Now scroll down and highlight Ambulatory Surgery Center. Select Provider page will appear. Click on name of the specific ASC you want to use. Remember to always choose from these online options. Never put in an unlisted provider. This will cause delays. Referral request page will appear with summary of all that we have entered. We now have to enter the diagnosis. Click drop down to highlight most common diagnosis, or can press the Select Diagnosis button. Now click the button. Select Diagnosis page will appear. You have two options. Enter ICD-9 in the Diagnosis Code box, or enter description of the diagnosis in the description box. Let's put in gastritis for our patient. The first option described the patient's condition better, so we clicked on that option. You will then be taken back to the referral request page. If you have another diagnosis code, click onto Select Diagnosis 2 button and follow the directions from the previous slide. Once you have completed the diagnosis codes, you can click on the Select Procedure 1 button. Referral request page will appear. You can click drop-down arrow in front of Select Procedure box and get a list of most common procedures. You can then highlight the desired one. Alternatively, you can click the Select Procedure 1 button instead. You will now be taken to the Select Procedure page. You will type the description of the procedure in the box in front of Description box. In this case, we typed in EGD and click Search. You are now given multiple choices. Click on the desired procedure. Referral request page will appear with summary of all that we have entered so far. Now you need to enter clinical data. There are two boxes that will need your attention. One is the reason box. Whatever data you put in this box will appear on the authorization note to the specialist. So it's almost a form of communication between the referring provider and the consultant. The note box, however, is the most important section of any auth process. The data you enter here will go to the medical director who will review your authorization. You can even copy and paste the doctor's entire note in this box. It's perfectly okay. So, pearl of wisdom. If the data is concise, indication is applicable, the auth can be approved without attaching notes. This step is especially useful when the last note is not available or has not yet been completed by the physician. If the notes section is blank and notes are not attached, your authorization will not be processed or approved. Now click Submit. You can now see your authorization with all the details, including the authorization number and the expiration date. You are almost done. This last part is also very important, how to attach the doctor's last note. Click on the Upload Attachment link at the bottom of the page. The authorization attachment page will appear. Now click on Browse button and a pop-up list will appear. You will see a comprehensive list of your files on your computer. Now scroll down to the note you want to attach and it will get highlighted. Click the Open button. You will now see the file you chose filled in the box in front of File. The box below it is where you need to give a descriptive name to the note you want to attach. This step is necessary as the system will not allow upload without a name for the file. Try to be short and descriptive. Use labels such as X-ray or doctor's note or colonoscopy. You can now click Upload. Now, before we leave this page, on a side note, you will see in tiny print 2 lines on permitted file extensions. What does that mean? The permitted types of files are listed. This simply means that the system can only attach and upload your files that have been saved in these formats, such as doc, Excel, etc. If you try to upload and system says you can't because of your file format, don't get frustrated or disappointed. Just go to the original file, click Save As, and choose from a drop-down arrow how you want to resave your file. This way, you can choose the file to be saved in the allowed format. Now you will be able to attach it. Don't be scared. It's not hard. If I can do it, I'm sure you can too. The authorization attachment page will reappear. You will see the attachment you uploaded on top in the yellow section. Anytime a provider wants to look at the attachment, they can do so by clicking on the link. You can upload more files if you wish by repeating the same process. Now click Return. The selected authorization page with summary of your authorization will appear. Please look at this authorization for accuracy of what was selected. That's it, you're done. Auth is sent to Regal for processing and forwarded to the medical director for approval. Congratulations. Do's and don'ts of prior auth. Pearls of wisdom. Okay, on the top of the never list, never put in authorizations as urgent for vaccines, screening colonoscopies, and routine procedures. You will be contacted and asked to change the status, which of course delays your authorization approval. Never send in an authorization without either doctor's note attached or the Note to Medical Doctor section filled with detailed information of why requesting the procedure. Always request providers listed on RIA. Your turnaround time would be better. Always check on authorization history of the patient before you put in an authorization. Your auth may be a duplicate, meaning someone in your office has already put in an auth for you. Trust me, you will save a lot of time if you just do this simple step. Always pick an ambulatory surgery center over a hospital for minor procedures. Always ask your doctor if the procedure can be done at an ASC. Always check to see what facility the doctor is privileged in and choose one that is in-network. It usually is faster and easier to use an ASC for the doctor and even the patient. On a side note, Regal can always help your doctor get on staff at a contracted ASC, so call us if you need help. So when you're requesting a colonoscopy, make sure you include history of prior colonoscopy if done, type of colonoscopy requested, such as screening, diagnostic, or therapeutic, the pathology of the polyp if known, such as tubular adenoma, villus adenoma, etc., would be helpful. When requesting a bone density, please fill the bone density questionnaire available in the main menu page on RIA. By the way, you can access the forms requested by going on RIA. Click on left toolbar and select Medical Documentation button. A drop-down will appear with forms available. Sleep apnea patients frequently need to have sleep studies done and CPAP machines requested. So when you have a sleep apnea patient and you're requesting for a sleep study, please make sure you attach the sleep apnea questionnaire. Also, when requesting a CPAP machine, make sure you attach results of the last sleep apnea study that was done on that patient. How to find medical records. We have been working on this very useful tool to help you get medical records from hospitals and specialists. It's easy peasy. All you have to do is click on the eligibility, find a patient, and click on View Authorization History. Find the hospital or specialist authorization that has been approved and click on it. You can then click on View Attachment at the bottom of the page, and voila, you can give the notes to your doctor instantly. Imagine all the phone calls you just saved. Here's a visual of what I just described. In this slide, we click on View Authorization. We are taken to the Search Authorization page. Now click on a chosen authorization. You will be taken to the authorization page. At the bottom, you will see Upload View Attachments link. Click on that link. As you can see, you've been taken to the authorization attachment page. You will see that there is a link there that is the specialist's records. Or if you chose a hospital, it would be the medical records from the hospital. You can now click on that link. It will open the attachment. You can review it online, you can print it, or save it to the patient's chart. Well, we've reached the end of our presentation. Congratulations, you sat through the whole thing. And also, I would hope that you would contact me if you have any further questions or suggestions. My contact information is listed on the screen. Till the next time, bye-bye.